Age Hospital. Dr. Nishchal, welcome to our live workshop.
Thank you so much for inviting me. Very happy to interact with parents related to a very, very important topic today. Thank you so much for inviting me.
So, today we are going to talk about meningococcal meningitis disease. So, Dr. Nishchal, to begin with, could you please explain what meningococcal meningitis is, including its causes, symptoms, and why is it important for our parents to be aware of this condition?
For sure. See, today in 21st century, we will have one or two children in a family, and we mostly live in a nuclear family most of the time. So every child is very, very precious. We cannot afford our child to get sick. We cannot afford they become so sick that we may have to hospitalize, or we cannot afford to lose our child also. So it is very important and imperative for every parent to know about this important disease, which is we call it as meningococcal meningitis. Now let me explain. Meningitis is the infection of the brain. So, whenever a bacterial infection which is caused by Neisseria meningitidis reaches the brain and causes meningitis, it is called meningococcal meningitis. So, it is caused by a bacteria. Now, there are various kind of meningitis. It can be caused by viral infection. It can be caused by bacterial infections. Most common causes of bacterial meningitis in children are three. Number one is H influenza B bacteria. The second one is streptococcal pneumoniae bacteria. And the third one is Neisseria meningitidis. Now, this disease, which is caused by Neisseria meningitidis, which is called meningococcal meningitis, unfortunately, this disease develops very rapidly. So it is a rapidly progressive disease. On day one, child might have mild cough, cold, a little bit of irritability, occasional vomiting. And day two, it immediately reaches to the brain and child might start crying inconsolably. Might start becomes extremely irritable. Child might throw a seizure, that is epilepsy, or we can call it khench also. Along with that, child might develop altered sensorium. Child who is recognizing parent will not recognize their parent. Child might throw a seizure, or child might go become unconscious. So this is very rapidly progressive disease, and within 24 to 48 hours, we may lose the child also. So this is very, very important that we diagnose this disease very early, because child immediately needs to be hospitalized in the intensive care unit, needs to be start specific antibiotics, sometimes steroids to prevent the brain damage, and also lot of supportive care in the form of oxygen, intravenous fluids. Sometimes child might require ventilatory support also. So the first and most important thing which we must know as a parent is this is a disease which progresses very, very fast. First 1 or 2 days, you and doctor might understand that this is just a simple viral cold, because there will be mild cough, mild cold, mild fever, child will be irritable. But on second, third day, there will be a rapid progression. So this is very important to know. The other two bacteria which is causing meningitis, that is H influenza B and streptococcal pneumoniae, since years we have been preventing this disease with the help of specific vaccines. And now this Neisseria meningitis vaccine is also available. So we will discuss about it in the future, and we'll come to know how we can prevent this disease also.
Sure, sir. That's what we are looking forward in this workshop. And parents, let me tell you once again, in this live workshop with Dr. Nishchal, we are going to learn about uh, meningococcal meningitis disease, its vaccinations, and high risk children for this disease, its complications, and more importantly, we are going to learn about the protection and more. So, doctor, let's proceed with the questions and please tell us Despite significant progress over the last few decades, meningitis remains a mysterious disease worldwide with a high death rate as well. So, what is the reason for this alarming death rate?
See what happens in children. Children are not able to express themselves. Like if an adult has headache, the person will be able to tell you that I am having headache. If the child has headache, child will not be able to explain that he has headache. Only thing that he can do is he will cry. So many a times we miss the early diagnosis of meningitis. That is number one. Second, the blood-brain barrier of the children is little weak. Second, the immunity of the child is not that developed. So a adult who is between the age group of let's say 18 to 40, 45 has so much robust immunity that they can prevent the development of disease in themselves, whereas in children the disease develops very rapidly. That is why we have been seeing the meningitis very frequently in children. Second, our brain is a very sensitive organ and is the most important organ of our body because complete function is controlled by the brain. So whenever there is some infection in the brain, it causes lot of damage in the brain. When brain is damaged, the function of the other part of the body is also affected. So because of that, the death rate is very high. Even if the child survives, there are a lot of complications which happens. See, child may develop blindness because maybe that part of brain is affected. Child may develop deafness because that part of brain is impaired. This meningococcal meningitis can cause meningococcemia. That is the Neisseria meningitis circulating in the blood, in the stream. And it can cause various blood vessels to be getting clot, or sometimes it becomes open. So there will be like hemangioma kind of things, or there will be some ecchymosis developing in the skin of the child, but that may be little late. There will be little bit of gangrene which develops at the end of the hands and the feet. So sometimes to save the child, we may have to cut the hand or limb in that child, so that child might be having that morbidity for the life. So 10 to 15% death rate. So every 100 children developing this disease, 10 to 15 may die within 48 to 72 hours. Remaining 30-40% children may develop some morbidity in the form of deafness, blindness, or some limb deformities which will be developing. So it is very important to diagnose this disease very early. Another important thing is this Neisseria meningitis bacteria, they are very sensitive to specific antibiotics. So it is very difficult to diagnose in the laboratory because they are fastidious, difficult to grow. Second, whenever we give any oral antibiotic, this may get destroyed and it is not possible to culture them in the laboratory. So sometimes we miss the diagnosis. Third important thing is the time frame because it is very rapidly progressive disease and we may have to diagnose at any very early age, start specific antibacterial antibiotics and supportive treatment in these children. If this starts within 48 hours, we may save the children completely in only 50% cases. So this is very important and we may have to continue treat these children. But the most important thing which I would like to tell all the parents is that there is a very effective vaccine which is available. That vaccine, when taken on time, definitely prevents this deadly disease, which is very rapidly progressive. We may lose our children, but it is preventable. Now, we have three bacteria which causes this disease. H. influenza B, and we all know that the pentavalent vaccine or 5 in 1 vaccine which is given in government setup or 6 in 1 vaccine which is given in private setup, this 6 in 1 vaccine contains DPT, diphtheria, pertussis, tetanus, H influenza B, injectable polio, as well as hepatitis B. These vaccines are given at 1.5 month, 2.5 month, and 3.5 months of the age of the child, which will prevent children from H. influenza B caused bacterial meningitis. The second bacteria which causes bacterial meningitis is called streptococcal pneumoniae. And we all know that pneumococcal conjugate vaccines, which are also given at the government setup and also it is given in private setup. And there are various vaccines which are available. And if we give this vaccine to children, the bacterial meningitis which is caused by streptococcal pneumoniae can be prevented. The third vaccine which I am talking about is the Neisseria meningitis vaccine. We call it meningococcal conjugate vaccine. Now, as we all know, the age is very, very critical. Less than 1 year children are more prone to develop this Neisseria meningitis disease. Up to 3 months, these children are protected because of maternal antibody. Whenever child is in the mother's womb, the mother's antibody is circulating in child's body. As soon as we separate them, it stays for 2 to 3 months to protect the child and then it disappears. Now we have a new meningococcal vaccine which we call it as meningococcal conjugate 4-valent quadrivalent vaccine, ACYW, which can be given as early as 9 months of the age, the first dose, and after 3 months, we can give a second dose. So, after first dose, 14 days after the first dose taken, child is protected against this Neisseria meningitis caused vaccine. And when we give a booster dose after 3 months of the first dose, almost for next 10 to 15 years, the child is protected against this disease. If your child is more than 2 years and child is not been given this vaccine at younger age, after 2 years also we can give one single dose of this meningococcal conjugate vaccine. We call it as Menectra, and that single dose protects your child at least up to 15 years. Now the second age at which this disease happens is the teenagers between the age of 12 to 18. So we know that whenever they go and stay in the hostels, dormitories, or whenever they go abroad for studies, they may require one more dose of this vaccine at this age. So that another important thing is these teenagers and the older adults like you and me, we harbor this meningococcal meningitis bacteria in our throat. So we transfer this infection to younger children, that is less than 2 year or 1 year. So when we reduce the disease burden in the society, the the nasopharyngeal carriage of this bacteria reduces. So in turn, the infection goes down drastically. In India, we have been seen many places like Northeast, the North India, the some part of Western India developing these diseases. But when we started, I said that one children, mostly two children, we need to protect them from the disease. So vaccination is most important, and we must give them vaccination on time.
Of course, vaccination is definitely, surely very much important to prevent our children, our kids from meningococcal meningitis disease. Thank you so much for making us understand about this disease, about how to prevent it, and more importantly, about the vaccines, about the types of vaccines that are available. And apart from this, doctor, I am very much sure most of the parents must have this doubt in their mind. When we talk about vaccines, parents are also doubtful about the side effects that those vaccines might have. If you could just tell us about the side effects, if there are any, for the children of different age groups as well.
Absolutely. The newer vaccines which are available now are having very, very least side effects. We all adults have taken COVID vaccines, the first dose, the second dose, the booster dose, the second booster dose, and we all know it might cause little bit of discomfort at the injection site, mild pain, sometimes little swelling, or a fever for a day or so. And a simple paracetamol, if taken regularly can take care of these minor symptoms. Same way, children also might develop this kind of mild pain or fever, a little bit of little swelling at the injection site. But if we give them paracetamol within a day or two, they will be fine. But in my experience, see, I do my private pediatric practice in Ahmedabad in the area of satellite since last 20 years. And since last 5 years, I have been given these meningococcal vaccines to almost all the children who come to vaccinate at my place. And I have rarely seen any side effect in these children. Parent never call back that child has developed this and that, what can be done. So it is very, very safe vaccine. 99.99% will not have any major side effects. Few 5 to 10 or 15% children might develop mild pain, fever, or swelling that can be controlled with simple paracetamol. See, vaccines are actually antigens which is entering into our human body. Our immune system recognize this as something which is not our own. So they develop specific antibody against this antigen which enters the body. So this reaction gives little bit of pain, fever and swelling. Once this vaccine has been recognized or the antigen has been recognized and antibodies are produced, whenever actual infection happens to the child, our body is already immune. Immediately, these antibodies will go and kill this bacteria. So, this disease will not be developing these children who are vaccinated. I always tell that to take vaccine is like taking insurance. We as an adult always have a mediclaim insurance, even though we know we mostly will not fell sick. But even if we fell sick, if we have good mediclaim coverage, our expense can be taken care of. That is number one. We never drive a two wheeler or a four wheeler without insurance being taken properly, because we know if accident happens, if something like recently we have lot of water log in Ahmedabad, in Vadodara, in many cities because of this flood. If your car is properly insured, the engine is properly covered, even this kind of water logging damage to your child, your car can be covered properly. Same way, these vaccines are insurance for your child, because we don't want our child to suffer, develop fever, develop seizure, need hospitalization, need lot of antibiotics. This takes lot of mental peace away. We may lose our job days, child is hospitalized, we are not able to go to the office, and the expenses going up and up because of long hospitalization. Better it to prevent with a good vaccine, so that the child will not suffer, we may not suffer, we may not lose that much money. So taking vaccine on time is always like taking an insurance in your child. So rather than worrying about its cost, it is always imperative that we must find out ways and means to create that and give the all the vaccines which are available, so that we can prevent child from that vaccine preventable diseases. This is very, very important. So it is very imperative that every month we visit the pediatrician, ask for the vaccines which are available, take our vaccination on time, follow the schedule. Government gives those vaccines which vaccines or the disease are life threatening, which is detrimental to the public health at large. Whereas in private practice, every child is 100% precious. So in private, whatever vaccines we give, like flu, influenza vaccine, like typhoid conjugate vaccine, like meningococcal conjugate vaccine, like hepatitis A vaccine, like chickenpox vaccine, and their booster doses at 1.5 year, 4.5 years. These are very, very important to prevent children from various diseases. Among them, this meningococcal vaccine is also very important. So don't lose the track of your vaccination in child. Go to your pediatrician, ask, learn, and take proper decisions so that you can take the vaccines for your child on time.
Sure, doctor. And while we are discussing about meningococcal meningitis disease, its vaccination, its prevention, we have a question from one of our parents, Sankhjaya, who is asking, can this be prevented if my child has a strong immunity? If yes, how can I improve my son's immunity? Please
Yeah,
guide.
very good question. Thank you so much for asking this question. See, strong immunity for sure prevents many diseases in these children. But when we have a specific bacterial disease which vaccine is available, then it is always better to protect specific vaccine, specific disease by that vaccine. See, there are many bacteria, there are many viruses which can cause infection in children. If your child has good immunity, they will be prevented by this kind of infections caused by other viruses and other bacteria. But we want specific, like when I am driving a car, I will wear a seat belt. Even though I am covered fully, completely, there are glass around. I know if there is accident, I will be saved because of the external covering that I have. Even though I will have a seat belt, because that will prevent me specifically from banging myself or going out of the windshield. So that the specific the seat belt, the vaccine works like that. Now there are various ways and means in which you can increase the immunity of your child. First and foremost is mother's breastfeeding. For first 6 months, every children, every child, every infant should only and only get exclusive breastfeeding from the mother. We have seen nowadays, because of cesarean section or because of some other reasons, we do start the formula feed or top milk very early. But if we give exclusive breastfeeding for first 6 months and nothing else to the child, that definitely gives lot of immunity to the child. After 6 months, it is always better to give home based food, that is seasonal fruits, seasonal vegetables, all pulses like dal that we have. Gradually we can increase the portion size, we can add some amount of taste to that, we can increase the various formulation to the child. We continue breastfeeding till 1 year, 1.5 years, and add a lot of fruits, seasonal vegetables, and control in the child's diet. So good diet also increases immunity of the child. We have to take care of the cleanliness around the child, like giving a boiled clean water to the child, keeping the room or the place where the child is playing or sleeping as clean as possible. We must inculcate the habit of frequent hand washing to ourselves and to our children, so that they wash their hands properly. 1 or 2 times warm water drinking will also help them a lot to increase their immunity. Many a times we have this myth that many fruits causes cold and cough. That is absolutely wrong. Seasonal fruits like orange, the mosami, narangi, the lemon water, coconut water, banana, this all increases immunity by giving the child vitamin C, calcium, and lot of minerals which are required for the child to develop their immunity. So this is important. The another important thing is avoid bottle feeding to the child, avoid outside food to the child, avoid packet food to the child, because this has, we don't know what kind of preservatives that have, what kind of oil which is used to fry those things, what kind of material used to prepare those things, we don't know. So try to avoid this packaged food in your children. The another important thing is regularity of sleep, because sleep also increases a very good immunity to your child, the mental health as well as the physical health. So the child's sleep schedule also should be very regular. So if we can take care of these things in your child, even if your child is going to school, the regularity of food, regularity of sleep, regularity of potty training, these all things are very important to increase your child's immunity. And being pediatrician, I love vaccine, so regular immunization also increases your immunity.
Of course. Thank you, Dr. Nishchal, for guiding us about how parents can help and boost their child's immunity as well. I hope, Sanjaya, this answer was helpful to you. Now, moving ahead, for all those parents who have joined our workshop now, please, I want to tell you that today we are talking about meningococcal meningitis disease, which is a very serious infection that affects the protective layer around the brain and spinal cord. That's what Dr. Nishchal is telling us about. But thankfully, now there have been major improvements in the prevention of the disease as well. One such measure is preventive vaccination, which can save lives and reduce complications. In addition, good hygiene, as Dr. Nishchal just mentioned, good hygiene and social distancing of kids from the infected individual is also essential for the prevention. So, doctor, I want you to please tell us more about this disease. That how serious is this disease, and particularly what age group of children are bound to be affected by this disease, are prone to this disease.
Yeah, this is very, very important because when we know which age group are getting infected by this, we can do prevention in that age, which is very critical. We all know children are very, very less protected with their natural immunity. Less than 5 year children are more prone, less than 2 year children are very, very more prone, and most commonly we have seen this disease in less than 1 year of the age. So, early age has more risk factor because child is not that immune to diseases because child is not exposed to these diseases. So less than 1 year children are more prone to develop this disease. The second age group which is very prone is teenagers between the age group of 12 to 18. So those teenagers who are staying in hostels or those teenagers who are studying in colleges, they are more prone to, they also need vaccination to be given. Now, why they are more prone in this age? Because younger the children, their immunity is not that developed. So they are prone to develop. The teenagers who stay in the house or those adults or elderly who harbor this bacteria in their throat may infect these children with the help of this Neisseria meningitis. So it is very, very imperative that we start preventing these children at very young age. So as I have told you that the two bacteria which are causing other bacterial meningitis, H influenza B and streptococcal pneumoniae, we are giving vaccine at the age of 1.5 months, 2.5 months, and 3.5 months. The Neisseria meningitis child is protected up to 3 months by maternal antibody, but now the vaccine which is available can be given as early as 9 months. So we can start giving first dose at 9 months. Within 14 days, child is immune, and the second dose at the age of 1 year, and that protects child till 14-15 years of the age. So younger the age, more prone for this disease. Again, younger the age, the progression of disease is very fast. As I have discussed in the beginning, almost 10 to 15% of these infants who develop meningococcal meningitis die within 48 to 72 hours, and those who survive develops lifetime morbidity in the form of blindness, deafness, and sometimes their limbs needs to be amputated because they develop gangrene of those parts. So child if survive has lot of morbidity to live with. So these are very, very dreadful thing for parents to see the child to live. So it is always better to prevent this disease with the help of timely vaccination. Early diagnosis is the key. Early management with specific antibacterial, proper supportive care, and then surviving the child intact is another important thing. So, early infection, early prevention, both things are very, very important.
And definitely opting for vaccination for the prevention is surely very, very, very much important. So we have so many questions coming in from the parents. We have a question from Sushant who is asking, can this disease be hereditary?
No, any bacterial infection cannot be hereditary. This is a bacterial infection caused by Neisseria meningitis, that we call it as meningococcal meningitis. It is never hereditary. There are few children who born without immunity. They don't have that immunity inside, and if they have that multiple immunity deficiency, then they are prone to develop this disease more. But otherwise, this disease is not hereditary at all.
I hope, Sushant, this was helpful for you. Now, moving ahead, we have question from Namrata, who's asking, my nephew is 3 years old. How to know if he is at the risk of meningitis? What would you suggest?
If 3-year-old child has not received meningococcal meningitis vaccine, I would prefer that you talk to your pediatrician and take one single dose of meningococcal vaccine, which is Menectra, and that will prevent the child for next 15 years for sure. We cannot predict that this child is prone or that child is prone, but it is always better to prevent the disease by vaccination rather than waiting for disease to happen to your child.
There's another question from another parent named Mannat, who is asking, can meningococcal meningitis occur more than once?
It can happen more than once because there are five various strains of Neisseria meningitis which causes meningitis in these children: A, C, Y, W, and B. India, the most common strains or the serotypes are A, C, Y, and W135. So these four are the most common Neisseria meningitis strain which causes meningitis in these children. So it can happen more than once for sure. But if we take the vaccine, your child is protected against all four types of meningococcal meningitis and is absolutely safe in this situation.
Now we have another question from Geetu, who is asking, what should I do if I suspect that my child has meningococcal meningitis?
Take the child and rush to the hospital. Tell your pediatrician to hospitalize your child. Because it is very difficult for a parent to find out that child is having meningococcal meningitis. As I have said in the beginning, day one, there will be mild cold, a little bit of fever, child will be irritable, and nothing else will be there. After 24 or within 24 hours, if your child is crying excessively or child sensorium is altered, like he is not recognizing parent or he is vomiting consistently, or if child develops seizure like a convulsion or a catch, then it is always better to take the child, rush to the any pediatric ICU and hospitalize immediately. So this is the only thing that a parent can do if you suspect your child has meningococcal meningitis. Because it is an real emergency, child needs to be hospitalized in ICU, immediately start treatment so that child can be saved or the brain damage can be saved very fast, very rapidly.
One of the parents, Ria, wants to know, how does this disease spread?
It is always spread by an adult having Neisseria meningitis in their throat. So someone who is having mild cold or cough, if the child, and that is because of Neisseria meningitis, the harboring in the throat. If the child comes in contact with that person, then definitely it has been transmitted from that to that person. So those adults who have cough cold in the family should always wear a good mask when you are near to any child in the family. And especially if the child in the house is less than 1 year old. It is always better to wear a mask when you are near to that child, because we all know COVID was transmitted through cough and cold only. And when we wear mask, created a social distancing, have, did a frequent hand washing, and we could control that very powerfully with the help of the vaccine which was given to all of us. Same way, this disease is transmitted through the oral secretions or the nasal secretions. So a distance and a good mask will definitely prevent this transmission to these children.
One of the parents, Ashima, wants to know, how is this meningitis fever different from a normal fever?
That is what I told you. It exactly looks like seasonal flu. It presents like seasonal flu only in the first 24 to 36 hours. There is no difference in the fever itself. But after 48 hours or 36 hours, if the child is crying continuously, altered sensorium is there, he is developing conversion, not recognizing parents, or sometimes there is rash in the body which is very severe, ecchymotic rash, like there is a bleeding in the intradermal, then this can differentiate immediately, but these are very late findings. So it is always better, rather than wait and diagnose Neisseria meningitis, meningococcal meningitis, it is better to prevent with a vaccine on time.
Definitely vaccine is very much important. And when it comes, doctor, when it comes to the new parents, they are very much concerned and mostly confused about how to take care of their newborn, how to prevent them from various infections. So there is one of the new parent, Ravleen, who is asking, my baby is 5 months old, can small babies also get this disease? Please share how to prevent it.
See, 5 months child is definitely at prone to develop this disease, because up to 3 months the child is protected through maternal antibody, and the vaccine which is available cannot be given before 9 months. So the things which I said, exclusive breastfeeding to your child, minimum exposure to other older adults, teenagers, those in the family who has cough cold or some infection should wear good quality mask when they are nearer to your child. Proper bathing, cleaning of your child, the child's sleep cycle should be very very powerful, so that child develops lot of immunity through that. But the most important thing is avoiding child taking to where the crowding is there, overcrowding or a closed environment is there, and continuing breastfeeding up to 6 months and nothing else are very very important to prevent this disease in your child.
While we have discussed about the symptoms of meningococcal disease, Divyani wants to know, my child has red rashes on the back and legs. Could it be meningococcal meningitis?
No, no fever, no meningitis. So this rash could be because of many things. One, it can be prickly heat because of the hot weather. It can be some allergy because of something that you have applied to your child, maybe a new soap, maybe a new massage oil, maybe new cloth that your child has recently wore. So this could be a mild allergic rash only. So do not worry, show to your pediatrician, and child should be fine with good quality lotion as well as some medicines orally. It cannot be meningococcal meningitis, so don't worry.
Diksha wants to know, is this meningococcal meningitis disease contagious?
It is contagious definitely, but once the child develops meningococcal meningitis, child is hospitalized. So that child will not definitely will infect other children. But whenever we diagnose one meningococcal meningitis in a family, we give prophylactic rifampicin to other family members. So the other children, the older ones, and the elderly one will get the rifampicin dose, which is a protective prophylaxis against this meningococcal meningitis or meningococcal disease. So once the child is diagnosed, the other family member will definitely get one prophylactic antibiotic immediately on diagnosis of this child's meningitis. So this child cannot infect other children or elder, because the child is hospitalized and others are getting prophylactic antibiotic immediately.
Another parent, Sushant, wants to know, does a child's immunity or meningitis depends upon the birth interval or family planning?
No, actually no. But definitely birth interval of 3 years are very very critical for mother to develop the complete things which she has lost during the previous pregnancy. So if we have a good time between two birth, the mother will be properly immune against the disease. She will again regain her physical structure, she will gain her complete immunity. This will give a good birth weight child, a newborn, because prematurity and low birth weight are very common to have less immunity and may develop these diseases very frequently. So birth spacing is very important for health of the mother and health of the second or third child. So definitely not specifically for Neisseria meningitis or meningococcal meningitis, but for overall health of the child, mother and the nation, spacing between two children are very important.
Kunal wants to know that if the child is having meningococcal meningitis, so can it be treatable with antibiotics? Can it be treated with antibiotics?
Yes, very potent antibiotics are available, but meningococcal meningitis, or for that matter any meningitis, needs to be hospitalized. IV antibiotics and IV fluid needs to be given. Minimum 14 days of IV antibiotics are must for these children to recover completely and fully. But 100% very potent sensitive antibacterial or antibiotics are available, but it has to be given intravenously. So child needs to be hospitalized and then only we can treat. There is no oral antibiotics which can be used or which is useful, but a long duration of 14 days antibiotics is very important.
Of course. Dr. Nishchal, since we do not have enough time left, just to wrap up our discussion, could you please share any three precautionary measures that parents should take to help protect their children from this meningococcal meningitis and also ensure their overall well being?
Yeah, for sure. As I have already discussed, the most important thing is exclusive breastfeeding for 6 months. What do we mean by exclusive breastfeeding? Exclusive breastfeeding is within 1 hour of the child's birth, the mother's breastfeeding must be started. First 3 days of colostrum, which is yellow colored thick milk which comes in mother's breast, are having lot of antibodies which gives lot of immunity to the child. For first 6 months child should be given only and only mother's milk, not even water is required. So this is first and foremost thing. Second important thing is, for first 2 to 5 years child should be encouraged to eat home based food, seasonal fruits, vegetables. All pulses is very important. The child should be given boiled or a good quality water to drink. And the third most important thing is to increase the immunity of the child. A regular vaccination as per the chart of the pediatrician or the government is very important. As we know, every child is precious to us. There are vaccines which are not covered in the government vaccination schedule. So even if you are taking vaccines at government setup, there are many vaccines which are available at private setup. You must talk to your pediatrician and complete these vaccines. Meningococcal meningitis, as I have said, is very common in less than 1 year children. So at 9 months and at 1 year, we must give these children 2 doses of meningococcal vaccine, which is called Menectra. Even if your child has not taken the dose at 9 months and 1 year, you can give it at 1 year and 15 months or 15 months and 18 months. If your child is more than 2 years, you can take single dose of Menectra and your child is protected up to 15 or 18 years. So these are the three important points which I would like to share to you.
Thank you so much, Dr. Nishchal, for your valuable insights today. We appreciate your time and efforts for helping us better understand about meningococcal meningitis disease. Thank you so much. And
Thank you.
also, thank you for all our parents for joining us today. We hope you found this session informative and useful. Have a great day, everyone. Thank you.
Thank you so much. Done?